and they're very involved with students as well. So I'm going to talk a little bit about that. What makes you sick? Right.
Viruses.
Viruses. You got it. I wonder how you guessed that. What else? What makes you sick?
You don't consider yourself a good mental or physical health?
Say that one more time.
When you don't consider yourself in good mental or physical health?
That is a state of sick. But what is it that makes you sick?
Bacteria?
Okay.
Stress.
Stress, that's a good one. What else? Oh, come on, I'm being graded today.
Lack of food and housing.
I'm sorry?
Lack of food and housing.
Lack of food and housing. And those are some of the factors that we normally associate with illnesses. And in the United States, for the past 50 or so years, we have been accumulating an immense amount of information about health disparities, how people experience illnesses or health or access to medicine. The problem is that since 1994, when President Clinton said we have to do something about the disparities, we'll start to wonder what we do. Where do we go? What kind of policies can we implement? And that was a big issue because even though we knew that there were so much disparities by class, by gender, by race, but we do not have really much of a clue where to start, where to go. And that is a big conundrum. And for me, this is sort of like the starting point in some of the studies that I have been implementing for the past 2 years here in Chicago. And I'm particularly interested in one particular group, and that is immigration, immigrants. About 2 or 3 years when I started to think about this idea, I went to our officials, the CDPH, and this is the Chicago Department of Public Health, and Illinois Department of Health. And I said, okay, just give me all the data you have about immigrants because I'm ready to start analyzing it. Can you guess how much data we have about the health status of immigrants in the state of Illinois? Where 28% of our labor force come from? Any guess? Zero. And this is raising a lot of questions already for me, right? And probably for you. How is that possible? This is a nation built by immigrants, and we are so proud of being a nation of immigrants, right? Well, we don't really care about how their health status is. And that is a good question. Why? Why is that happening? May that had something to do about the health status of immigrants? The lack of data? One possibility. So you agree with me? Thank you. So what I would like to do today is to share with you some ideas that we have been putting together in a research project. So, but I would like to very briefly tell you a little bit about social determinants of health, which is a theoretical perspective that has been mostly developed outside of the United States. A community-based participatory research, which is an approach that for the past, I'll say 10 years or so, Dr. Susan Stagg was visiting at Spring I see, may correct me at any point. And tell you a little bit about this study that we have been doing in this advocacy, and see how we can combine some of those ideas into one particular study. What the folks have been saying in terms of the social determinants of health is that we get sick by 2 different ways, and viruses and all of that, yes, all of that is involved. But what it really affects our health are the material conditions where we live. And the actual physical sources of illnesses are not necessarily the largest percentage of causes of illnesses, but it's actually the material conditions where we survive. And that, at least for me, makes sense because this is what we do every day, what we breathe every day, what we eat every day, and so on, right? So when it comes to income, for instance, well, income mediates anything that we do in life, right? So So that makes perfect sense. So at that level, that is something that we have already known for many years that there is a relationship. What we have not thought about much is on the subjective part of social relations. What do I mean by that? What is a subjective? What would be a good example of something that is subjective? I see the wheels turning. Status. How do you know what your status is among friends? It changes all the time, right? You may be with the cool group, and you may be with the nerd group, and your status changes depending on the group you hang out, or the group that you hang out with, right? So if you are the nerdy type, among the nerds, hey, you're cool. But among the party ones, you're in trouble. Right? And that relationship that we have with the group seems to have a very, very strong correlation with how your body reacts. And I'll come back to that in a minute and tell you why these folks have been thinking that the subjective effects on health, meaning the subjective social status, may help us explain a few things. And I'll come back to this. This makes sense. Please feel free to stop me at any point. The other part that I wanted to share with you is this an interesting approach that has been developing mostly in the US. Is that true?
And also Latin America,
That's
like
right.
liberation psychology and those types of things.
Yeah. Oh, thank you, Susan. This is fomenting partnerships with communities. And by partnerships, and this is something that Susan and I have been discussing for a little while, it's really partnerships. As you probably know, the academicians, we are famous for going into communities to tell people what their problems are and how to solve them. And we have no idea about the community that we are referring to. But we've come with this attitude, get us in trouble a lot of time. And so the partnership, or the idea of the partnership, is really to become more humble in the way that we relate with people. And go and sit at a table where we are going to share knowledge, the knowledge that they have and the knowledge that we have. And that is the most important part of this idea. The other part that I think is really interesting is that it focuses not only on what is necessary or what is problematic, but it also focuses on the resources and what is there available that we could use to address some of the problems that we are going to find. And the last part that I think is really cool, and this is something that I would like to start advocating even more, is the idea of translating the research that we are finding into policies, into programs, into things that we could actually do. So this is the way that I understand this particular model. So it's a very innovative way of doing research at the community.